So, first of all, congratulations for receiving this Guinness Book of World Record. I have heard that in 15 months span, it's your third record. Tell me about this achievement, sir, and how and why it is very significant.
Thanks very much. I believe that it is the work of the foundation over the past 2 decades. We have left no stone unturned in our mission to create the much needed awareness about the importance of early detection of breast cancer, because breast cancer is a taboo issue. It is the commonest cancer affecting women in India. And because of lack of awareness and absence of a robust population-based screening program and not having equitable care across the country, more than 60% present in the advanced stages where very little can be done. So our goal all along over the past 2 decades has been to leave no stone unturned in creating that awareness through a number of innovative and unique initiatives. I relocated back to India when my mother was diagnosed with breast cancer in 2007. Between 2007 and 2017, we launched a number of initiatives such as the Pink Ribbon Campaign, the Pink Ribbon Walk to create awareness, Paint the City Pink campaign, and numerous awareness lectures up and down the country. So that certainly did help to break that taboo, because when I came and started giving lectures or talks or awareness sessions, people would hesitate to come even in urban cities. Today, that's not the case. There's a lot of awareness. After a decade, 2017 to 2026, in fact, in 2017, inspired by our Honorable Prime Minister's Digital India campaign, the foundation brought out the world's first mobile app on breast health, which is called ABCs of Breast Health, which explains about every conceivable aspect about benign breast disease, that is non-cancer problems, and breast cancer in simple, easy to understand format. It's been brought out not just in English, but in 11 commonly spoken languages, which was launched by Shri Amitabh Bachchan ji. And in 2026, we are at a stage where artificial intelligence has come out in a big way, even in medicine. And so to bring together medicine, artificial intelligence, and immersive technology under one platform has been the next step in our mission's foundation's mission. And what we did last week is we launched 2 major initiatives. The first one was we utilized artificial intelligence, and it's an artificial intelligence enabled holographic version of me, which is a 3-dimensional version of me with my face, with my voice, and a 3-dimensional full image, which gives the depth, which actually gave a 30-minute lecture on breast awareness. Traditionally, awareness programs focus only on cancer, but 9 out of 10 breast problems are benign, non-cancer problems. So 15 minutes of the awareness session that was delivered by a holographic educator of me focused on benign breast diseases. The remaining 15 minutes was on various breast cancer related issues and demystifying some of the common myths associated with both benign and breast cancer issues. After the 30 minutes, there was a multilingual question and answer session where the holographic educator answered any aspect relating to breast health from the floor in English, Hindi, Telugu, and Tamil. So also, we have ensured very robust guardrails, ethical guardrails. So if someone asks a question where she should go for treatment, or is a particular doctor very good, it would not politely decline and say it is a holographic representation. In fact, I myself asked the holographic educator that day in front of everyone, can I go and visit a particular hospital? And it declined to give that answer. So ethical guardrails is very important. So therefore, this holographic technology using artificial intelligence, giving a 30-minute lecture both on benign breast disease and breast cancer and answering questions in several languages is a first in the world. And therefore, when we approached Guinness World Records a long time ago, they said that there is no record in this category at all. So in fact, they have created a new record for this particular awareness session, and we are very pleased that that we secured the Guinness World Record for the largest artificial intelligence health awareness interactive session. So that is what we launched last week, which actually happened, and that is what secured the Guinness World Record. So,
my second question would be, sir, about breast cancer. Now,
let me just come. So hologram was a technology to attract the attention of people. And so hologram can't be done every day, everywhere. So what we have done is we have launched what is called NARI, which is National Awareness and Resource Initiative for Breast Health, and a digital avatar of me with my face and my voice would be available 24 hours a day. At the click of a button, people can access credible evidence-based information, which would be provided by a digital avatar of me, not just in English, but in all the Indian languages. So that is going to be available soon. And through these artificial intelligence enabled initiatives, we hope that we are able to democratize the access and democratize the evidence-based information relating to every aspect of breast health, reduce the stigma and demystify some of the common myths, encourage early detection, and stand shoulder to shoulder with people, women who have been treated for breast cancer and also breast cancer conquerors who have fought the disease.
About the changing lifestyle and breast cancer threat in our society, sir, in our time, working women are there. What advice you will give to all those people around, and how big is this challenge and threat, sir, as a disease?
Breast cancer, like other diseases, has become a lifestyle disease as well. Any factor that increases the exposure of the hormone estrogen over a prolonged period of time can potentially cause breast cancer. In addition to the well-recognized risk factor, the main lifestyle factors are late marriages, not having children, having the first child after 30, not breastfeeding, physical inactivity, smoking, alcohol, obesity. All these are lifestyle factors which can potentially increase the exposure of the hormone estrogen for a prolonged period of time on the breast, which can cause breast cancer. So in fact, 20 to 30% of breast cancers can be prevented by ensuring that women follow a balanced diet. They ensure that they're physically active, that is 30 minutes of aerobic activity every day, at least for 5 days a week, avoiding obesity, of course, stopping smoking. If anyone is smoking, smoking is associated with several problems, several illnesses, several cancers, including breast cancer, reducing the intake of alcohol, and being sensible, to follow meditation. It's very important that, stress is playing a huge role in our lives. It's very important every day for people to keep their mind away from their body. And that also helps in many ways. So I think it's lifestyle changes certainly help to reduce the incidence of breast cancer.
If a person, if a female, she find that a certain kind of abnormality is there in her body, so what advice you will give her? What should be the initial step?
The two ways to fight breast cancer are, firstly, women of all ages. If they notice any new change in the breast, particularly a painless lump in the breast, recent indrawing of the nipple, blood-stained discharge from the nipple, excoriation of the skin around the nipple areolar region, any dimpling of the skin overlying the breast, they must not ignore. They must report to their doctor without delay. That is called breast awareness. The second component is women 40 years and over must have an annual screening mammogram. And by following these two methods, we are able to detect breast cancer early. If we are able to detect breast cancer early, we can save scores of lives. And I would like to take this opportunity that it is the duty of the men in the household to take care of their woman, because the woman is the nerve center for the family. If she is well, the family thrives. If she is not well, the family will not be well. So it is our bounden duty. We have so many festivals in the year. In addition to gifting a sari, or instead of gifting a sari, it's the duty of men in the household to gift their mother, their spouse, their grandmother, their aunt a screening mammogram every year. By doing so, we can definitely make a huge difference in terms of saving scores of lives in our country.
Now we have talked about detection and what a person can do. Now, costing, generally whenever we talk about cancer, in general taboo around cancer treatment is this very costly. So how government of India is helping, how different state governments are helping, and how agencies are helping, and your app and how your institute is helping in this.
So before talk about treatment, I think it's early detection. Government of India actually has launched a population-based breast cancer screening program by way of clinical breast examination, where the healthcare workers who are working with the government, when they visit the homes in rural areas, they examine women's breasts according to a set protocol, which is referred to as clinical breast examination. And although screening by way of mammography is the best way to detect cancers early, in our country, where more than 70% live in rural areas, mammography is not a viable option because it's too expensive. We don't have trained radiologists to pick up early cancers. So the second best screening tool is clinical breast examination. In fact, between 2012 and 2016, in partnership with the governments of Telangana and Andhra Pradesh, Usha Lakshmi Breast Cancer Foundation helped to implement a large scale, in fact, it was at that time a very large scale population-based screening program where over 200,000 underprivileged women spread across 4,000 villages were screened for early signs of cancer. And if there was any abnormality detected through this clinical breast examination-based screening program, they were referred to the district health officials and treated free of cost through the Arogyasri. And of course, after this program was successful, I was incorporated into the technical advisory group, which was initiated by the Government of India. And I'm very pleased to say that this screening program is now being implemented across the country through the National Health Mission alongside oral cancer and cervical cancer. But unfortunately, only 1% of our population, the target population, are being screened for various reasons. And we have brought it to the notice of the government, and we are trying to explore ways to work around it. So that is early detection. In terms of treatment, as I mentioned, in our state, we have Arogyasri scheme, and also in the neighboring Andhra Pradesh also. And nationally, we have the Ayushman Bharat. Through this, nationally, the treatment costs have significantly come down. And all cancer-related treatments, whether it's surgery, chemotherapy, radiotherapy, hormone therapy, and targeted therapy also to an extent is being covered by these schemes. So therefore, even underprivileged women are able to get treatment, the best of the treatment that is available anywhere else in the world.
Any final advice or suggestion to the government, to the common people? Yes.
The government of India can only do so much. It is very important for NGOs to come forward to create that much needed awareness and utilize artificial intelligence, because with artificial intelligence, you can reach out far and wide without any geographical borders and without any language barriers. You are able to reach and democratize the awareness, accessible information, and break that much needed, create that much needed awareness by breaking that taboo. So it's the duty of all of us, the NGOs, and of course the government as well, to create awareness and ensure early detection by making the existing population-based screening program robust. As I said, only 1% of our population is being screened for breast cancer, cervical cancer, and oral cancer. So we need to strengthen our population-based screening program. We need to make sure that cancer is a notifiable disease across the country so that data can be collected and we're able to do research on this. And finally, it is the duty of us, the primary responsibility of our health lies with us, not with someone else, but with us. So women over the age of 40, wherever you can afford, you must have a screening mammogram every year. And it is the duty of the men in the house to ensure that the women in their lives get an annual screening mammogram. With these, I'm sure we'll be able to tackle breast cancer much better and save scores of lives.